Hi, I'm Shira Winter, and I'm from the Stanford School of Medicine, and we're going to talk about PPE portraits, patient and clinician experiences at a COVID-19 testing site.
I'm Juliana Baratta, and I also work for Stanford School of Medicine. For the background of this project, the COVID-19 pandemic mandated PPE in healthcare settings. This obscured clinician faces and expressions, which led to a depersonalization of patient care experiences. PPE portraits, which is when clinicians affix a photo to the front of their PPE, was introduced and helped maintain patient-provider connection at times when patients might be fearful, isolated, or unable to identify their clinician. The objective of the study is to evaluate patient and clinician experiences with PPE portraits. The setting was a drive-through COVID-19 testing site at Stanford Medicine, and the population studied include 18 patients, 6 clinicians that were interviewed from March to April of 2020. Patients were interviewed by phone, and providers were interviewed and emailed to answer certain questions.
So as you can see from the middle picture, this is what the PPE portrait looks like on a healthcare provider. And we extracted 4 themes that overall demonstrated that PPE portraits were effective in creating patient-provider trust. The PPE portraits humanized the testing experience. Patients like knowing who was underneath all that gear. They fostered connection and trust, and patients said that it was helpful in seeing who was giving care, identifying who was giving care, and providers were helped by being able to establish more of a rapport, more of a relationship. It also reduced anxiety and fear and made the patients feel more at ease, and it signaled that the institution was providing holistic and high quality care. We found that for a minority of patients, PPE portraits had no impact, partially potentially due to fear. Going to a COVID-19 testing site, especially in March and April of 2020, could have been a scary experience, and they may not have noticed the PPE portraits because of the overall effect of that experience. And then the majority of clinicians at the testing site thought that the intervention could and should be replicated at other sites where PPE is used. So overall, PPE portraits was effective at fostering this patient-provider connection, and that this intervention could be disseminated to other sites. Some patients didn't notice it, potentially due to the fear of the experience, and more information is available about the PPE portrait project below at that link. We'd like to thank all of the collaborators and co-authors on this project, as well as the Gordon and Betty Moore Foundation. Thank you.